thousands of teens are heading to college for the first time this fall. Now could be a good time for parents to consider switching their health care from a pediatrician to a primary care physician. Joining us live this morning is primary care physician Dr. Andrew Wrong with Hartford Healthcare Medical Group in Westport. Doctor, thank you so much for your time. Good morning.
Oh, my pleasure, Alyssa. Great to be here.
Well, there are a lot of changes. A lot is going on for first-time college students, freshmen, right? So is this the time to really start discussing that transition from pediatrician to primary care physician?
Yeah, it's a big transition time for our adolescents slash young adults. They're going from really becoming independent advocates for
Mhm.
themselves, living by themselves. College is a big time for them, and for them to be able to learn to advocate for themselves, yes, absolutely. That's the ideal time to switch from a pediatrician, where maybe their care is more directed to them from the pediatrician and their parents, to really becoming the advocate for their own health care. Maybe even a little bit earlier, maybe a senior year of high school, where it may take a little bit of time to transition to an adult PCP, but definitely by start of college.
You know, for some of these teenagers, they have been with their pediatrician for, let's say, 18 years. So you maybe haven't really thought of this. You are so comfortable with your doctor. Where should parents really start? Is this something where your pediatrician may refer you to a PCP? Do you have to do your own research? What do you recommend?
There's a lot of issues there. So for most healthy young adults, the transition should involve talking with a pediatrician, and they'll know other great primary care providers. And the pediatrician will know your young adult as well. So they'll be able to give good advice about who to go to. Obviously, you want someone who's in your network as well.
Yeah.
So you want to make sure that they're on your health insurance's directory. And there's nothing better than word of mouth. So other parents, doing some research and legwork to always find out who might be a good match for your young adult. And you also want to make sure that they're part of that process as well.
Hmm.
Do they want to join a big practice? Do they want to join more of a smaller type practice? Are they more comfortable with an older provider, a younger provider? Will they open up more to a male or female?
Exactly. All good
Again, this is
questions.
their time to shine, their time to be advocates, and the most important thing is for them to be someone they're comfortable with.
And to be with someone hopefully for years and really establish that care and that relationship. I have to ask you, speaking of that relationship, it must be hard. It is hard for, I'm sure, a lot of teenagers to leave their pediatricians. So at what point do the pediatricians, I guess, kick them out or stop seeing those college-aged patients?
Yeah, it on for the most part, most pediatricians will recommend that their young adults switch to an adult type provider around 18 to 21. And it may depend. Are there maybe some complex pediatric conditions, perhaps childhood asthma or
Mm,
severe allergies that are related directly to pediatric conditions? And maybe it makes sense for the pediatrician to uh, do that handover a little bit more gradually.
right.
I've had a few patients who come over at the age of 21 or 22. That still happens. But it's very important, I think, that we're aware of the lifestyle changes that come
Sure.
about when we enter college, sleeping habits, perhaps introduction to alcohol and tobacco products.
Right.
It's really important that a provider is familiar with those adult lifestyle and medical conditions as your young adult transitions to adulthood. So that's part of the process. So start the
Absolutely.
process early.
A lot to think about. Dr. Wong, thank you so much for your time.
Oh, my pleasure. Have a great day.
You
Thank
as
you.
well.